Hello everyone. I'm recording this a little after the 11th hour of the 11th day of the 11th month, which is Remembrance Day, and I just want to take this opportunity to give thanks for all of those who've given their lives in the service of others through the armed forces, protecting the public. As of yesterday, 8 a.m., Wednesday the 10th of November, we've had an additional 320 community cases and 5 cases of people positive as they were leaving quarantine. They obviously now remain in isolation. That's a large number of new community cases, but I wanted to try and shift where we're focusing our concerns, because as some will have been discussing, this really is more in terms of how our healthcare services are being used. The large majority of people who are positive are having either no symptoms at all or are having mild symptoms and managing well at home. And I thank you for that. Many people with COVID will have very mild symptoms, maybe a fever, maybe a cough, and will be able to take simple paracetamol, and after a few days, just like with many viral illnesses, will feel quite well again. We were able to undertake what we call a tabletop exercise on this Monday, where we had all of the 3 hospitals, senior members of the staff from those 3 hospitals in a Zoom call together, along with Hazard Management Cayman Islands, members from the Deputy Governor's Office, and also members from the Cabinet Office, to undertake an exercise where we planned and discussed how we would manage 40 patients coming with COVID, then 100 patients, then 200 patients, in sort of a stress test scenario to see exactly what we would do, what steps would be taken in a lot of detail. All of the hospitals already had plans, but we really wanted to see how these plans would work together as a whole, as part of our planning for the reopening process. What we discovered was that the number of beds that would be given over to COVID and still allow routine operations to go ahead would be 55. That means that the elective surgeries would continue, the clinics would continue, and across all of the 3 hospitals, 55 COVID patients could be looked after. So when you think about the 15 admissions that we currently have at the Georgetown Hospital, because there are none in the Doctors Hospital and none in Health City, you can see that we're only actually consuming 27% of the available capacity that the hospitals have put aside to look after COVID-19 patients. That leaves us in a good position. Clearly, we are reopening, and also clearly we are managing the numbers that we have, and we've been in this scenario with positive community cases for some 9 weeks now. And you'll be aware that in many countries around the world, these so-called waves of infection, as they travel through the community and a lot of people get infected, often take around 2 to 3 months to begin to see them burning out. Ours may be burning out a little bit slower because we put in measures particularly to dampen down the infection, so masks, distancing, hand hygiene, our very high vaccination rates, and also the lateral flow tests being used and the policy being rolled out. All of these things will dampen down the spread of SARS-CoV-2, and that's exactly what we want to do, to make sure that the hospitals do not have too many patients at once. Just to give you a little bit more details on those admissions, it's obviously of concern that 3 of those people are in the critical care unit. 1 is requiring a ventilator, and 2 are requiring what we call non-invasive ventilation. That means they're needing some extra respiratory support more than oxygen. It's like having a little bit of, it's like having what we call pressure support, a mask over your face, and then a machine gives you a push when you begin to breathe in, and it helps you to breathe a little bit better, but it doesn't involve the endotracheal tube that goes down the windpipe. So there are 3 people that are needing that extra level of ventilation support, and there are 12 others who are on the general wards. Of the total 15 people, 12 of those are unvaccinated. From Tuesday to Wednesday, 4 people were admitted and 4 people were discharged. And then from Wednesday to Thursday, 5 people were admitted and 4 people were discharged. So even though you hear the number of people that are actually admitted to hospital, this number is moving and changing at all times. The actual people are changing from day to day, which is, again, is good news because people are getting better, they're being well treated, and they're going home. One last message I wanted to give. As we're coming up to the holiday weekend, I'm really excited to be having an extra break. I know we all are, but I will be keeping my entertainments to the outside where I know it's safer. If you're going to mix with people, please do so outdoors. If you can hold off having big parties and big gatherings, especially in indoor spaces, please do so, because that's the wise and sensible thing to do when we have such widespread community transmission. And in particular, be careful of those who are unvaccinated, for example, children, and for those who are elderly or vulnerable. Those people need particular attention with regards scrupulous hygiene and mask wearing if appropriate. And also for the unvaccinated, do consider getting vaccinated. You'll be aware that there's a slight pause in the vaccination program. Our next delivery is due tomorrow on the British Airways flight, and the vaccination program will be beginning again next week. Thank you, and have a pleasant holiday weekend.